Everyone. Welcome to our webinar today. People are still slowly trickling in. Feel free to add in the chat where you're joining us from and a fun fact of what the temperature is outside today. As you may check, because I've got a jacket on, it's a cool 53 in San Francisco today. So we'll start today, as every webinar, with just a couple of housekeeping announcements as people come in and some guidelines for our interactions today. Most of you are probably very familiar with Zoom by now, but just as a quick reminder, we're going to use the Q&A function to suggest questions for our wonderful speakers and panelists, which we'll get to towards the end of this webinar. Then we're going to use the chat function for any sort of technical difficulties or anything that we can help you with as you troubleshoot. And we'll also provide resources in the chat as well. There'll be links that will be dropping in throughout the conversation that we have today. So just remember Q&A for questions and then chat for some tech issues and to keep up with the resources. It's great to see all the different locations coming in as people share. Another thing that's going to help our conversation today is really, we like to start with a community agreement. So as we participate in the webinar, we also want people to feel comfortable and also engage in respectful conversations. So we have a few guidelines that we'll be sharing in the chat. Just as a quick reminder, we have try it on as you listen to our speakers and engage in the chat. Please be willing and open to try on new ideas. Consider different ways of doing things that you may not prefer or may not be familiar with. Practice mindful listening as you listen to the speakers and engage in the chat. Be willing to be surprised, to learn something new and listen with your whole self. Practice self-focus, attend to and comment about your own experiences and responses. Do not speak for a whole group or express assumptions about the experiences of others. And practice both and. So consider and instead of but. And this practice acknowledges and honors multiple realities. We prefer no blaming or shaming in the chat. Refrain from that, shaming yourself or others. And confidentiality as we take home learnings, but don't really identify anyone from the chat other than yourself, now or later. If you want to follow up with anyone regarding something they said in the chat, ask first and then respect their wishes. So I'm going to start today with some background as to we, Build Healthy Places Network, came to this webinar and to be in this moment. So back in 2023, we found ourselves sort of at a unique moment, really, an opportunity that we saw as communities and sectors really began to emerge from the pandemic, remember that? And there was this growing momentum to think about how can we rebuild and rebuild differently? And taking the lessons that we had learned and then figuring out how we can strengthen our capacity to center racial and health equity as we reimagine the role of public health. Build Healthy Places Network partnered with the National Association of Chronic Disease Directors to host a thought leadership roundtable that was held in Washington, D.C., and that brought together leaders from the public health and community development sectors. And our goal with that really was straightforward, to create a space where we could have generative discussions to examine the opportunities and the barriers to how those two sectors collaborating can support under-resourced communities and create equitable policies and approaches for residents to thrive. And it was a very, very fruitful conversation. And some of the insights from that we later shared in what became our primer for public health and community development working together, and we can share the link for that. And it was really designed as just a starting point. We knew we couldn't fit everything on there, but just a starting point to think about how these connections between race, between health and place all intersect and explore the potential for these two sectors to work more closely together. So many things came up during that conversation, not least I'll mention that too few people between community development and public health knew each other. But one theme that did come up consistently from the practitioners across both these sectors was a challenge they were finding in the right language to describe this work. as the terminology around health equity was beginning to get more scrutiny and debate. And that was really very much, this was 2023, remember, a foreshadow of where we are today. So some of those insights led us to develop our fact sheet, which was called Crafting a Health Equity Centered Narrative, which we published earlier this year. And it was designed to help practitioners develop narratives that can advance health for all communities. So the fact sheet is really a synthesis of resources and concepts around things like how we can leverage storytelling or think about our framing when we're talking about this work to try and really with the goal to try and strengthen cross-sector collaboration and drive meaningful change for communities to be able to thrive, everything that they need to be able to thrive. So I'm really excited that today's conversation gets to build on all that foundation. So it's been our journey as an organization to arrive here, which very much feels like at the beginning. So because in many ways, I think the work starts here, where we can create spaces like this, share with wonderful practitioners like you, and really come and learn together. So I'm really excited to start today to welcome our first guest on today's webinar, who's Dr. Laurie Dorfman, and who is the director of Berkeley Media Studies Group, which, like BHPN, is a program of the Public Health Institute in Oakland. And the group, she oversees Berkeley Media Studies research. They do media advocacy training and strategic consultation and education for journalists, as well as consulting with programs across the country on public health issues, helping them to apply the principles of media advocacy. So welcome to the webinar, Laurie.
Thank you, Ruth. Thanks for having me.
Yeah, you're welcome. So, BMSG, I'll say for short, has 30 years experience in guiding organizations to this better understanding how to use media and systems change the health and for health and social issues. And so I feel like we've arrived at this moment where I think many of us are struggling with what's the best, what's the most effective, what's the most meaningful way to communicate with each other around advancing health equity and to sort of better understand each other, all in the middle of what sometimes feels like an absolute blizzard of information or background noise to sort of get that messaging. And as I was preparing the questions for our conversation today, I found myself with so many questions, it was hard to know where to start. And it occurred to me that probably mirrors where many of us as practitioners are and what we're experiencing right now, a sense of wanting to engage, but feeling uncertain about the best entry points in this current moment. So what do we need to be thinking as first steps? Because you had mentioned the need to remind folks what they know, that they know things. So I'm curious,
Right.
what do we know, Laurie? Where would we
Right.
start?
We know a lot, Ruth. This is nobody's first step. Everybody who joined this webinar has been at this for a while. You've been at this for a while. I've been at this 30 years. That's all the gray hair up here. I tried to match the gray hair. Okay. So here's the thing. It is overwhelming. It's devastating, as a matter of fact. It is an onslaught like personally I've never felt before, and I have been at this a really long time. And I thought we were in a crisis when Reagan was president, for heaven's sakes, and I was working in HIV. So so things have gotten worse. And it's gotten harder to talk about things when the very words we use are under attack. So we can get to that, but I think there's two things to remember. One is that it's important to speak up and not get too worried and stymied by, am I saying the perfect words? There are no magic words. And in this moment, speaking and being present and especially when there are whole swaths of our population for whom right now it is too dangerous to even leave the house. So it's important for those of us who can to speak up. So that's thing number one. Thing number two is to remember why we're here. And each of us entered this field because we cared about something. For me, it was I really wanted the world to be a better place than it is, and public health seemed like a logical way to make that happen. So I walked through the public health door. Some other people walked through the journalism door. Other people walked through the community development door. And we got here and started to try to understand our field better, try to understand how the problems were started and what the solutions were. And that leads us to data. And the data become very important and they guide the way we make choices about the recommendations and the solutions we think are going to benefit the most people and bring health and thriving communities to light. But it's not the data that motivate people or attract them to the issue. We weren't attracted to the issue because of data. We were attracted to the issues because of what we cared about. So really the first step is for people to reconnect to why they're here and make that part of what they say. Because people connect to the values of the issue. And then when you do that, you can open up people and they can then understand why the data point to this and that or the other thing and why that's the selection among myriad solutions that you're advocating for. But first, connect with people around why this matters to you. Start with you. Start with you. We can't all go out and do focus groups, but we can know why we're here. And if we articulate that, we'll connect with the people who share those values.
Thank you. Yeah, that's amazing. I think you said connecting around the values of the issue is really something we heard even in that roundtable was the idea of what are the values that those words that we're using signal, that
Right.
and that's there's a lot more overlap with people in those underlying values. One of the things that you had mentioned was this phenomenon of the spiral of science.
Mhm.
What is it, and how does that really impact our work when we're trying to build this movement and momentum?
Yeah. The spiral of silence is a theory from communications that says that people are reluctant to voice an opinion if they think they're the only ones who have it. So that's why it points back to the first thing I said, showing up, saying what we need to say. Don't get stymied by whether it's the perfect word. I mean, people agree with us more than you might imagine. And when we're when people are asked, how many people do you think agree with us? They estimate very much lower. So people aren't going to step out themselves if they feel like they're alone in doing it. That's why it's important to plant the flag, to say why this matters, and then to very clearly point to the solutions.
I think that, that's really sort of interesting that you said around people not being feeling safe to voice feelings that they have. And I think it also means digging a little deeper than the language itself to the values for people to be able to come out in a way to support or change their minds, I think, too. I think that,
Mhm.
I mean, what do you think about that sort of creating pathways for people to be able to say, I misunderstood what that was meaning, but I agree with the value that you've pointed out to me.
You make me think of two things, Ruth. The first is that, there are people who are never going to agree with us, and that's too bad, but they're wrong. But that's okay. We don't need to have everybody agree with us. There's no occasion in the policy realm where you need 100%. If we're voting, we need 50% plus one. And that kind of rankles, I think, public health folks in particular, my peeps, because everybody, we want everybody to want the same thing. We want them to understand that putting resources here will help these people there. Now, when the policy passes, everyone benefits. So everyone is affected and everyone's health can be lifted, but not everybody has to be engaged in the same debate. So that's just important to know. The second thing, let's see, you reminded me of two things, but now I forgot what the second thing was. Say the question again.
It was around, I just say it off the top of my head, but it was around people being able to find a way to sort of say, I
Ah,
misunderstood
yes.
other language.
Okay. So that leads to the second thing, which is that we have to speak in plain language.
Mm.
Like people, we use a lot of code in our professional worlds, and that code is necessary. They call it jargon. The code has a jargon, right? Okay. So we speak in sometimes we speak in codes in other ways too. I'm not really going to go there, but in our professional life, there is a vocabulary that we use. And the reason it's so important that you brought together people from community development and people from public health is because they have similar goals. That's why you can straddle both
Mm.
worlds, but they use a different vocabulary. Okay, they can't communicate if they use a different vocabulary. They have to learn each other's vocabulary. It's important in when we're developing policy. It's important when we're doing the science. We need the shorthand. We need compact ways of talking to each other about that. But anytime we're outside, anytime we're facing outside the circle, we have to explain what our words mean, and we can't use code. Not everybody knows what morbidity and mortality is.
Mhm.
Everybody knows what death, illness, and injury are. And as a matter of fact, everybody who knows what morbidity and mortality are know what death, illness, and injury are too. So using plain language doesn't hurt us in our circles, and it's required if we want somebody else to know what we're talking about, especially in our highly polarized political circumstance right now, where labels immediately send people signals about whether they should agree or not. So if you
Mm.
can avoid the labels, if you can get tangible, if you can bring a picture to mind for people, tell them what it means rather than what the label is, then you get underneath all that and maybe have a little better chance of helping people understand why the issue matters so much.
Mm. Yeah, that's a great point. So that brings me really perfectly to my next question, because one of the big questions people have been asking that we've seen in our partners, especially in the current climate of sort of this increased scrutiny of language and the signals that that sends as to whether they should agree. I love that, whether somebody should agree with you or not, just based on the word rather than the content.
Right.
There's been a lot of focus on the word equity in this work, um, specifically in the context of DEI. But if we take a step back, many people in various sectors had already found that language problematic and ambiguous in certain circumstances.
Right.
So, how important is it to use the word equity in our equity centered work? And I know many organizations, much like us, have had to wrestle with when and how, and are we abandoning that work, the work, by if we're not using that word? What have
Yeah.
been the challenges with equity?
It's a tough question. And you can imagine for us at BMSG, where we've been telling people use tangible language and avoid jargon and all this stuff for years. We've been telling people
Right.
that we are absolutely swimming in irony right now because today to use the term equity is a political act. So it is going to be dicey and it's going to be difficult. And some groups are just not going to be able to do that. And even for those of us who can use the term, it's still important to say what we mean by it. I mean, you're right. Most of the people I know thought DEI was lousy language. They didn't really use it. Now, of course, they're terrified because that those words are in their title and their titles have to change in some
Mm.
public facing, government agencies and things like that. So it's still, even if we're using the term, we still have to say what it means.
Mm.
And if what we care about is families that can support themselves because there's a living wage and schools that are stimulating their children because the classroom is the right size and the teacher is well paid and the children go to school with a full belly, if that's what we mean, then we need to say that. And if we also want to say that it's imperative that we do something about the differences we've seen in the opportunities people have, because the data show us who is suffering most from the problems in our society and in public health, the data dictate where we pay our attention, then we have an obligation to do the work that we're doing, regardless of whether we call it equity. And I know that abandoning the word feels like it's an attack, it's a loss, it feels terrible, it feels like we're giving up. No one I know is giving up the work they're doing and finding ways to make the lives of people and communities better than they are so that the next generation that comes through is born into a place where people can thrive because communities are connected, because they have the resources they need, because we understand what it means to have robust social determinants of health. And there's some jargon for you, instead of those that might diminish people's health. So, not a clear answer, Ruth, not a
Right.
clear answer, but definitely it underlines the necessity, no matter whether we use the term or not, to say what it means.
See what it means. Yeah, right. We've definitely found that in, for some, it's a finance word. It means completely different implications than the equity from a public health perspective. So, one thing we chatted about, you had mentioned that there is, and this relates to the sort of momentum building, there's a nuance between telling single impact stories versus collective narratives. Could you
Mhm.
talk us through that difference a little bit?
Sure, sure. It kind of has two parts. And so the first part is understanding how people in our society in the United States understand most issues and how they interpret issues. And we have an abiding narrative in the United States that's about rugged individualism. The idea that if you can really try hard, you can succeed. We talk about people pulling themselves up by their bootstraps, and we all know there's a lot of mythology behind that. But nonetheless, it's an abiding metaphor. Even our computers boot themselves up. They start from nothing, they become something, the metaphor runs deep. Okay, so what that means is that people are most likely to interpret any kind of social issue through an individualized lens. When they tell stories about what's going on, unless they're cued differently, people are going to interpret stories in terms of narrow portraits about people. And that is problematic for us. I mean, it works for journalists, it works for us connecting to stories because we're people, we want to connect to other people. But if stories are told too tightly focused, too framed too tightly around an individual or an event, people won't understand why conditions matter and they won't understand why policy is necessary. So, one of the things that we need to do is pull the frame out so that portraits are embedded in landscapes. The landscape includes everything. So, it's big, it's hard to tell. The landscape includes all the social determinants of health. We can't describe all of them when we're embedding that portrait in the landscape, but we can pick some of them related to the issue or the solution we're seeking to help people see that there's more than just personal initiative that's going on. And it's really important we do that because the flip side of if you try hard and you can succeed is if you fail, it's your own fault. We worked for years on early care and education and childcare, and the individualism response to that is, what do you mean she can't find childcare when we're arguing for the need for subsidies, right? What do you mean she can't find childcare? She had 9 months. So
Mm.
people, well, if they can't find a job, have they looked? So that's going to be the first place people go. So we have to cue the second place. We have to help them see, sure, people need to do what they can for themselves and their families, but as a community and especially as a government, we have obligations back to them. We are connected to each other, and we have to be sure that people are getting what they need in order to succeed. If there's not enough to eat, then we need to be sure people are getting food. And we have a whole program that is wonderful about that called SNAP. So that leads to the second example I want to give you. So the we've cautioned against telling stories that focus too narrowly and stop short and don't bring the portrait into the landscape. But the other thing we do, and this is really happening right now, it's really important that people understand, for example, the draconian cuts people want to make to Medicaid and SNAP that are happening right now in our Congress are going to have devastating effects. And they're going to have devastating effects on families who really need that help that as a society we say we want to give. Those programs are wildly, wildly popular. There's another spiral of silence for you. Wildly popular. People, pretty much everybody knows somebody who has a family member in a nursing home that is supported by Medicaid. So there's some spiral of silence stuff to do here. But the
Mm,
other thing is that when we're telling the stories of what's going to happen if this goes through, we tend again to focus too narrowly on the harm that's going to come to a particular family, maybe a community. What I wish we were better at, what I wish we were better at BMSG and throughout the field, is explaining the benefits of what we're doing in government to the non-beneficiaries. So here's what I mean by that. You've got a hungry family, they qualify for SNAP, they get the EBT card, mom goes to the grocery store, is able to cook dinner that night, and her kid goes to bed with a full belly. That's SNAP. Her kid goes to school the next morning with a full belly, so can pay attention in class and isn't disruptive and is absorbing the learning. So SNAP has absolute impact on immediate families. But you know what, Ruth? There was another child who went to bed with a full belly that day. And that was the child of the cashier in the grocery store where the
mm,
mom went and spent her SNAP dollars because she has a job because people are coming in and spending their SNAP dollars and other dollars. So her boss, the store manager, can keep her employed. And she went home and her child ate that night and had a full belly. And you know what? That child's in the same classroom as the first child I mentioned. So
mm,
that's the interconnection. That's the benefit to the non-beneficiary. That's the way our programs have ripple effects that we're not quite as good at describing.
mm,
Partly because the we have a proximity problem. Like the things that happen out in the environment happen so far away from the individual act of what people are doing. It's hard to draw that
mm.
chain. But the more we can do that and the more we can be tangible and bring a picture to mind and not just use our jargon describing programs, the better people will really see what we mean and understand why we care about this so much.
Right. Thank you. That's such a powerful example of that interconnectedness of us all through one policy, one program.
Yeah.
And there's just a myriad of those all sort of connected together. And you had talked about that distance between the impact and the levels at which the decisions made. So I want to finish by talking a little bit about scale and about that scale. So we've heard many in our network about people's sort of focus shifting more towards local and or local or state government, and balancing that with the aspirations that many have for systems change work at the federal level, sort of moving between that. Who are the actors we should be thinking about engaging in narrative change if we want to get it to scale,
Yeah.
and change the systems at that level? But we're kind of trying to work at our local level too, or the decision
You know,
process.
yeah, scale's really important. I mean, people love to talk about innovation. I'm done with innovation. I think that we know what to do. Everybody on this call is working in areas where there is evidence. We know what to do. What we don't know how to do is bring it to scale.
Mm,
And I think partly for us at BMSG, one of the reasons we are very committed to working with local health departments, and we work with a lot of community organizers and community organizations as well. But I have a special place in my heart for local health departments because they are in every county in California. Sometimes there's more than one. And those local health jurisdictions are places where the benefit of public health is really brought to the ground in a very literal way. And so the advocacy to be sure they can do what they need to do and have the resources they need to do at the local level is enormously important. And we know right now we're having a lot of trouble at the federal level. And there's, of course, a connection because a lot of the dollars spent locally come from the federal government. It's how,
mm,
as a nation, we pool our resources to do together what not one of us can do alone. That's why I want April 15th to be a public health holiday, because it's about taxes, which is just really a wonderful way to pool resources. Now, there's plenty to change in the way government does its business. So there's a lot of advocacy that needs to be done. But people are more connected to their local government. They have more trust in their local government. And so it's definitely a place to start. And on big issues, even like big issues like tobacco control, one of the wins we can count in public health, we've had very little movement on the federal level. Most of the movement began at the local level. And the main organizing we had at the federal level was when the flight attendants decided they wanted a workplace that was smoke free because people smoking in the back of the plane, it went to the front of the plane and the flight attendants got it the whole time. They were the movers and shakers that got smoking out of airplane. Kids on this call, there was smoking on airplanes, ashtrays on every seat. Okay, so that's a big change. That was federal, but most of the stuff around tobacco controls happened at the state and local level. So there's plenty to do. And I think that we do need to have some attention at the federal level, clearly, and that's why speaking up right now, not worrying so much about what you're going to say, is really, really important. So we need both, but there's no reason not to focus locally.
I think that's great. Thank you so much, Laurie. That I feel like that's goes back to the beginning, reminding us of what we know, reminding us of what we've done and what has happened and what can happen. So I appreciate you joining us today and stick around for a little while. I'm just going to introduce our program manager from Build Healthy Places Network, Kevin Leacock, who's going to lead the second part of our discussion today. Take it away, Kevin.
No doubt. Thank y'all very much for that conversation. So as Ruth just said, I'm a program manager. I've been with BHPN for about 3 years now. And my team knows I like starting things with like a personal reflection, right? So like for me, I've been working with BHPN, obviously, like I said, for about 3 years. And BHPN is like an intermediary, right? And my work is like when I come from like really working like on the ground. I say like in the soil with folks. So I'm like a lot of times still sitting with how to make this work feel more tangible, right? And I was talking with Ruth. Ruth, we had a lot of conversation. Maybe this was sometime last week. I don't really like even remember by this point. But I told you to watch that Toni Morrison documentary, The Pieces I Am. And in that documentary, she has a line that says like, what can I do where I am? And she was like, writing books. She wasn't really like out like in the street and things like that, but she wrote books. She connected with folks who were like her to build movements, right? So in general, I think I had to concede that these webinars can't solve it all, right? I think that it's just one of those things where we have some conversations and we figure out how to use our skills and our positionality to really add voice to movements, especially for these oppressed people, right? And folks who we know, right? And I think that's regardless about where you sit within the spectrum, right? So I think for us as an intermediary, we wanted to then say, okay, who do we talk to who's on the ground? So we have two folks today that we can really, just get insights from the field to then understand how do we just like different, how do we think about this work differently? How do we approach this work differently? So with that, actually, I'm going to start with Rachel. Rachel, if you can come on camera. How you doing today? So, hey, Rachel,
Hi, Kevin.
what's going on? So, first, Rachel, thank you for joining us today. You are a director, right, at Wisconsin Partners, where you build and support multi-sector response teams in rural communities and provide strategic visioning, communications, and events coordination for nonprofit organizations. And we had one conversation prior to this, and I'm going to tell Lori that I'm not done with innovation just yet because there was a piece from your bio that you talked about that I thought was really interesting, right? Where you say that you believe that innovation comes through a space of tension as long as we're committed to doing work that's effective, even when it's not efficient. So I would love for you, if you could talk a little bit about your work and how you came to this thought about tension, right? And how does this approach help you build and support those multi-sector response teams in those rural communities?
Yeah, thanks, Kevin. I was terrified when I heard Lori say that we don't need innovation anymore. And I said, uh-oh, I know Kevin's about to ask me about this, and I don't know if I totally agree, actually. So in Wisconsin Partners, like you mentioned, we have two rural community-based teams and then one micropolitan. It's in the city of Appleton, so it's a small city. And then we also have statewide associations representing a number of different sectors. So there's some work that happens across sector at the state level, and then some work that happens across sectors in those communities, just as a little bit of more context for those joining in today. So in terms of thinking about tension, I grew up, I live, I work in the Midwest, and the Midwest is notorious for being Midwest nice. And what that often means is avoidant. We avoid conflict, we avoid tension, we just want everyone to get along. When people raise their voice, there's pointed fingers of saying like, you shouldn't be talking like that. There's tone policing that happens instead of looking at what is underneath that we need to explore. And so when we back away from those spaces of tension, nothing changes. The problems are still there. They're just not being heard. People aren't being listened to. We're not shifting or changing anything. And a lot of times the problems actually get worse. They're festering, they're rotting, and sometimes there's like these little explosions kind of that happen when it just gets out of control. And even when things are fine and not getting worse, a lack of tension also just means that we're following the status quo. We're just allowing the thing that's been going on to continue happening. And I think a reality is we can't afford to keep doing that. All of us are suffering in our own ways. There's ways that we want our lives to be better. There's ways that we want our communities to be better. There are major problems ahead of us, and we cannot fix them by ourselves. We have to work with other people to do that. And if you're going to work with anybody, whether that's your partner or whether that's your parents or your best friend, there's tension. Like, people are different people. And it doesn't matter if you're working across the political divide or across sectors or across communities or within your own home with another person, there's going to be conflict. And so rather than running away from that and acting like it's not there, let's face it. Let's look straight at it and use an asset-based common ground approach and explore that with curiosity and creativity to figure out what's going on below the surface or behind closed doors and what is possible that we haven't imagined before. So one thing that I think is profound is that if you asked people, like, what are you proudest of in your personal life? Almost everybody is going to say it was something hard. So I'm going to slow down a little bit, and I'm encouraging people weighing in to just pause for a second and think about, what are you proudest of? And I think for most of us, it's something like, I graduated college, I was sober for 90 days, I got out of an abusive relationship, I pushed myself on my marathon. Like, I did something hard and I finished it. Like, I did what I needed to do and it was tough. We're not proud of ourselves for doing easy things. What's the point of doing an easy thing? So that's tension. Those moments of discomfort, those moments of the thing being hard, that's tension. And so we take that same approach at the community level of saying the things that are hard are the things that are often worth doing. We're not doing it because it's hard, but we're doing it because it's worth doing. It's in alignment with our values. It's in alignment with our mission or goals. And I loved the quote you just shared, Kevin, of from Toni Morrison of "What can I do where I am?" So I thought this might be a nice example of looking straight at the tension and then flipping that from an asset-based approach. Where in my rural community in Wisconsin, there's this historic, beautiful old church right near downtown. It has an octagonal sanctuary and it had hundreds of people in it once. And now when you come in on a Sunday, there's 15 seniors who are sitting there very quietly, listening attentively to their pastor. And there's this kind of air of sadness of like, where is everybody? We're missing everyone. It's not like it used to be. And there's sort of 4 different approaches of the congregants. One group is acting like nothing is wrong. They're like, oh, people will come back. It's just a slow summer, but it's been a slow summer for 20 years. There's another group that says, this is a problem, but we're going to fix it the way we've always been fixing it, which is trying to recruit people to come to church, which hasn't been successful. There's a third group that sees the reality. People aren't coming and they just are like, it's doomed. There's no point. It's just all going to fall apart. And then there was this woman, Shirley Barnes, who's 82 years old. And she said, this building is an asset to our community. I'm going to look straight at this tension, straight at this space of despair. And instead of seeing this building as something that resembles failure, it is an asset to our community. So she had built a series of one-on-one relationships with people, brought them all together through direct invitation into this church basement. And within 2 years, suddenly there's a community center that's flourishing. There's a senior program, after school program. There's a clubhouse for a recovery group. art workshops, clothing swaps, business classes. There's a co-working space. Like this building now is flourishing and thriving because somebody was willing to look at a space of tension and explore it with creativity by working with other people.
No, and thank you for that, Rachel. There's a lot there. I know we only have 15 minutes to have this conversation, but I do love that piece around this idea about what we're proud of. I was actually talking to a friend at some point recently, and I went to like this journaling thing, and they asked us to write down 5 things that you're proud of. And I had a really hard time. I was like, man, like what actually am I proud of that's not like an accomplishment, right? So I think like you kind of just leaning through that, like the easy things are also things to also be proud of because honestly, they're not that easy sometimes, right? People aren't doing those things. So that's a good thing for us to just call out. But I want to get to our next question because you're kind of getting there now, right? But this idea that we talked about earlier, like using this word of, wording of equity or inclusion, how important is it to even say these words if we're doing the actual work, right? Or so for that piece, I would love to know, like, are there any specific strategies that you use to get people in the door if you're not leading with the issue first? We kind of just talked about it, but if there's any other way that we could talk about the role that shared values also play in this as well, too.
Yeah, so our core model in Wisconsin Partners focuses on building relationships before we need them and then identifying areas of mutual self-interest from a really broad base. And so the thought behind that is if I care a lot about something just because I care about it, and I find out that you really care about your own thing because you really care about it, we are both deeply invested in making that thing happen. I'm not doing it for your sake and you're not doing it for my sake. It's in our mutual self-interest to move it forward. So there's a lot of enthusiasm there. And so one of our best ways of finding out what is that mutual self-interest is to come at things from a really broad base. And what I mean by that is a wide range of perspectives, a wide range of sectors, and not starting the conversation in a narrow way. So we're not a housing coalition. I think housing coalitions are really important and having childcare coalitions are really important, but we get to be a really unique organization in saying, we just care about community, whatever that is. We just care about our state, whatever that is, and we care about the people in it. And so rather than coming in a really focused way in those one-on-one conversations, which are at the base of our model or foundational to what we're doing, we just ask in more open-ended ways, like, what are you passionate about? What keeps you up at night? If you didn't have to work, how would you spend your time? What do you really care about? And try to listen to and pay attention to the threads, number one, what's coming through for people, and then try to make connections for them and through them. So if I was meeting with Kevin and you brought something up, I would say, oh, have you met so-and-so yet? Let me introduce you to this person. And the more that we have a spider web of relationships in our community, the stronger we all are. So it's in my best interest to connect you to other people. And then I will also ask you, who else do you think that I should talk to? Because you're going to know people that I haven't met yet. And just by you making that introduction, they're going to be more willing to meet with me as a stranger. I loved seeing in the comments today when we came on this webinar, multiple people saying, Kevin, I'm here to support you. Lori, I'm here to support you. It's good to see you again. People show up and do things because they've been directly asked by somebody that they know and that they trust. And we can spend a ton of money and time putting out promotions and putting out flyers, but the best way to get people in the door is to invite them directly. So to answer your question, sort of number one is coming at things from in one-on-one conversations with really open-ended questions that try to get to their passions and values, connecting them with other people and using their connections. And the more that people connect, we all build trust, we build relationships and understanding and compassion. And we talk a lot about how we need everybody in our community to do something. We cannot handle these things alone. And rather than seeing incoming neighbors as a threat to these limited resources that you have in your community, you see your neighbors coming in then as an asset. You say it is a good thing for our community that we have new people coming in with different ideas, different perspectives, different values. This is a good thing. So we're looking at diversity, equity, inclusion, not by talking about diversity, equity, inclusion, but by coming in from, it is in my own self-interest that more people are coming in to my community, into our community, and making it a new community together. It's all of ours. It is in my own self-interest to work with people who I totally disagree with and figure out what do we have in common and how can we support each other. And it's not just for the sake of being nice. Like, I benefit directly from that. And so maybe that's sort of a third piece, is like a mind shift away from competition and towards collaboration, towards seeing everybody and everything as assets. We do use tools like power mapping and power and asset mapping. If Lori hadn't brought it up, I also would have talked a little bit about avoiding jargon. And then I do want to mention a fun activity that we do, which is a values bracket. So we line up on one side of a piece of paper 16 different core values like authenticity or courage. And on your own, you'll do it like a March Madness bracket. So you'll be like, do I value authenticity or courage more than the other? And you move that one forward. And then by the end, you have your one winning value. And then we ask people to go pair up with another person and compare charts and say, do we have the same values? Do we have different values? And then just be curious about it. Why did you choose this over this? And we found that it's just a fun exercise, and it's a helpful way to get people talking and thinking about values because there's some structure around it. Like if you went up to an average person and you said, what do you value? They might just kind of look at you like a deer in the headlights for a little bit. So it's just one way of opening that up.
Yeah, no, thank you for that, Rachel. There's a lot of great comments, like in the chat as well, too. Thank you for these things. And I know I got 2 minutes left with you, right? But this is one thing that I'm kind of hearing from you right now is this, that I've been thinking a lot about, is like being in proximity with others, like in a meaningful way. Like, where is that happening sometimes, right? But also not even with others, but like with yourself. So you can also write down these things and see what are your values and when are we doing that thing day to day, right? So I think these type of exercises are much needed to then understand what are even your values, right? So one last question for you, and you kind of hit on it early on, but just like, always working across sectors, right? Navigating all the challenging conversations when folks really a lot of times don't want to sit within that tension, right? What makes all this work worth it for you personally, right? So I think that's one thing that I would love to just hear from you.
It's almost hard for me to answer this because I don't know how it wouldn't be worth it. I just think it's so nourishing. It's an amazing space. I love getting to spend a day of like talking to somebody who runs the grocery association, and then somebody who's in the arts and somebody who's in county government, and hear how all these different people are so brilliant and creative and hardworking, and they are doing really important work within their own sector. And I just can think, oh, thank goodness. I thought this was a problem, and it is still a problem, but you're working on it. And I love that you're working on it. And I don't have to stress about it because I trust you to do the best you can. And by being sort of on the outside, I can say, hey, grocery association, did you know that the counties are actually working on something that you should know about, and you should talk about those things together? And your work is going to then propel itself and get further than it ever had. So I find so much joy in being in collaborative spaces and learning from so many different people who know their sector in so much depth, and it's amazing to learn things all the time.
Thank you very much, Rachel. We'll be talking to you soon. We have some Q&A time coming up later on with all three panelists. So I'm going to move next to Kelly. So Kelly, how are you?
No, I'm doing well. Thank you. Energized by this conversation so far.
Yeah, absolutely. So you'll be bringing us home right now, right? So I want to just set you up just really fast, right? So Kelly Easton is the president, CEO, and co-founding member of Action for Equity, where you are the strategist and visionary for the work that's happening, right, with the racial justice ecosystem in Winston-Salem, North Carolina. So I just want to say welcome again. And I would just love to hear like a little bit about your work, right? Because one thing that we've been talking a lot about, with our first call was this idea of creating inclusive, culturally affirming spaces. I'll let them know what that looks like for you, based on maybe some things that you even heard so far during today's conversation.
Yeah, man. Well, one, I deeply appreciated, just the opening. And the one thing that the speaker noted was that it is important to speak up and be present, and especially in a climate where there are so many who can't. And, achieving our missions, we have to get to a place where our mission is everything, and it becomes a priority. And we're very mindful of not becoming distracted or being pulled away by distractions. And for me, distractions would be anything that pulls us back to old ways of being and away from the new thing that we're seeking to build. And so in my work with Action for Equity, we are a grassroots organization, and we were an organization that was never really meant to be an organization. We were organizing, around bad conditions, bad air quality at a predominantly Black school that led to putting together a policy agenda, and then that led to us building infrastructure in order to institutionalize community voice. And I would say that when it comes to really being able to break down these silos and to be able to achieve the type of work around being inclusive and culturally affirming, it is very important for us to make sure that we have those mechanisms in place that gives voice to not only give voice but give power to people, and that those mechanisms are at the center of our work. A lot of times in the work that happens, we think about bringing community to the table in ways that are tokenized, or ways that where we may delegate certain things through an advisory to make decisions. But if we want to truly create culturally affirming and inclusive spaces, then we understand that there may be some challenges in doing that in the work that we're doing or the current infrastructures that we have. So we become very adamant about creating those mechanisms in the beginning and center them in our work, and that those mechanisms are working across, our movements, across our collective impact work, or even within our institutions.
Yeah, no, thank you for that. And would you mind? I know I heard a little bit about your work, right, with Love Out Loud and Foresight Futures. Can you talk a little bit about those two projects and then how that kind of fits into creating these type of spaces?
Yes, yes. And so we have a movement. We're really calling it a movement. It's called Thriving Together for Sight. And what we're seeking to do is to create the conditions and align the resources and institutions within our community in order to produce a thriving community. Our hope is for all people in all places and for Forsyth County to thrive. And so, as I mentioned before, we're Action for Equity, my organization. We are really taking the lead on institutionalizing that community voice, but we're also working with other partners in the community. We work with a partner called Love Out Loud, and their goal is to foster connectivity and to build bridges throughout our community. And they are a faith-based organization. And then we also partner with Foresight Futures, which that organization handles a lot of our data. They really serve as the community data hub for Forsyth County.
Got you, got you. And I have one more question about this. And you said this term to institutionalize community voice a couple times. When I hear institution, sometimes my ears perk up. I would love to hear like what you mean by that by that term of institutionalized community voice.
Yeah, and I use that word now as is a code. I think we can have better codes. I think we all understand what an institution is, and when we're talking about systems, and especially within systems change work, we have to identify and understand, well, what is the dominant. What is the dominant power structure? And that dominant power structure comprises of institutions and other systems, government, health networks, and philanthropy. And so a lot of times when we come to these shared spaces where we are collecting our thoughts and looking at ways to understand the problems of our community, we have these major forces at the table. And at best, we've seen where we will have a few community leaders who've been appointed to come and join those conversations. And we feel that that is not the way to achieve systems change work. We have to make sure that that as communities brought to the table, that they have the power, that they have the resources, and the capacity to be at the table with these other forces to make decisions.
Got you. Got you. No, thank you for that. And I think something that that we've been talking about this entire time is right, this idea of like holding complexities. And I
Yeah.
would love to know like how do you get people to engage with each other without judgment around complex issues, right? And still make sure that certain values and principles are not compromised. And I would love to have like any examples of that.
Yeah, well, one, I agree that conflict is there. Like there will always be conflict. And conflict is just anytime there's imposing thoughts around beliefs, values, policies, strategies. And for us, as we got grounded, it was very important for us to have a community-wide exercise where we defined, who we are not, what we want to ensure that we're not doing. And in that process, it gave us the ability to really define what is currently the status quo. We know that these things don't work. From there, we leaned into, well, who do we want to be? And from this work really emerged a value system. And so having that value system is important. However, it's only as effective as we utilize it. And so, in order to do that, there are times where we have to have hard conversations. I think that at the beginning, as long as we all agree on a line of sight, and if we say that we all agree that all people in all places in Forsyth County should thrive, no exception, then cool. So we're good on that. Now we can have deliberative dialogue and we can have differences around what the problem is, as long as we continue to come to the table and do it in a way where we're not disparaging, we're not personally attacking anyone, and we have the ability to just maintain tension enough to get on the same page in terms of our tactics, then we're going to get the work done. And we have seen this over and over again, and especially just around cultural differences. And so the last thing I'll say to that is that we ourselves are boundary leaders. We know how to navigate different spaces. Just in one day, I can go from, being on the ground with credible messengers to having meetings with our chamber president, mayor, or, president of our community college. The goal in all of those spaces, my mission is always the same. So I feel that boundary leaders know how to navigate these spaces without compromising or assimilating, to the status quo.
Yeah, and I think that's a term or like a phrase that comes up like a lot today so far, right? This idea like of the status quo, right? And I've been reading this book or just started this audio book from Prentice Hemphill. It's called What It Takes to Heal. And they have this quote in there, and I want to see what you think about it. It says, for some of us, our visions are a threat to order. And I would love to know what as you reflect on that, how do you see your work with the communities as a threat to order or to the status quo?
Yeah, our work is absolutely a threat to the status quo. What we know, because the data reflects it, is that so many of our systems are not doing what their missions, espouse. If we're going to ever do anything different, or if we're going to work better, then we have to disrupt that. We have to disrupt the notion that what is currently happening, that we can continue to go along this path. And sometimes we just have to disrupt the status quo of our comfort, or going into the freeze or flight mode, where it's so overwhelming to consider how we can ensure that everyone will have access to healthcare. And so one of the best ways to do that is to center the voices of community, the people who have the lived experience, who have the wisdom. When we do that, then we're able to nuance the problems in ways that we fail to do when we're not at the intersection, of those problems. Because a lot of times these problems, there may be a main problem, but there's always underlying problems, and there are always related problems that are reinforcing one another, that actually maintains that status quo. So we think that whenever you whenever you're dreaming or imagining something that goes beyond what we have, then it's unfortunately it's going to be a threat because due to our current structure and our current systems.
Yeah, no, thank you for that. And I know we're coming close on time here. And I think a few things that you just said, right? This idea of like going beyond, but also centering community voice. I think those things also tied to one thing I've seen you talk about before in previous webinars, actually, was this idea of being a better ancestor, right? And how that shows up in our work. Because thinking about things that's beyond us, things that we may not see, but like who are we if we're like a future ancestor? What are the things that we need to do now? What kind of systems do we need to build now? What kind of spaces to dream do we need to do, like, to like do that right now? What does that look like, right? So I would love to like know for you, why is that important for you to think about that idea of being a better ancestor?
Yeah, I think when we create space for transformation from within, so in this movement of being better ancestors, it first starts with the transformation within, and as we do that, then we become better people, and as we do that in community, then we become decision makers who will become better ancestors, and when we give our when we go through this journey, because it is a journey, as we go on this journey and through this process, what it does is if we're thinking about being better ancestors and we're considering 7 generations from where we are now, then it positions us to pause, and resist the urgency to act, and the urgency of acting um, will inevitably produce extraction in some kind of way, because it's like, oh, well, we got to get the money now. So then we begin to scope creep, or, we got to make sure that we move the needle. So instead of taking on this hard challenge, let's tinker at these small things. But when we're thinking about creating a future where our youth, our grandchildren, when we're thinking about creating a world for them, then we are going to be very thoughtful about, well, what is it that we want? And it gives us the ability to dream. And so part of the Better Ancestors framework for systems change, we actually put the Sankofa bird in the middle. And that Sankofa just really represents the notion of really looking back to the ways that indigenous folks have lived, looking back to the history of what has worked for community building, and bringing those practices into the center. And so when we do that, then we're thinking beyond, the current system, which we know is failing. And a big part of that is understanding that there's a time where we have to give hospice to old systems. We understand that these systems are failing, they are dying. And when we are able to grieve that loss, whether that's a loss and maybe you're comfortable with the status quo. So maybe it's a loss in understanding that we have to shift from the status quo. That could be a loss in power. Whatever it is, there may be a loss. But when we grieve and we give hospice to it in a way that brings dignity to the fact that we tried, some of us had the best intentions, it just did not work, then we're able to begin to let go of the old thing and create even more space for us to form networks that can consider the future.
I love that, Kelly. Just the idea of giving hospice to the old systems. I'm definitely going to steal that one. I'm definitely going to steal that one. And
Please do. Yeah.
but then also last thing I'll say is just that idea of pausing and reflecting. When do we get time to do that, like in our day to day, right? And I think with this whole webinar early, this whole thing right now is this idea of being in spaces where we can pause, reflect, understand how do we get there collectively, right? So how do we build that into our system? So I just want to just name that right there.
Yes. And this is it. So thank you for this work.
Got you. No, thank you. All right. So once again, Kelly, thank you. Rachel, thank you. Lori, thank you. And Ruth. So we're back now, right? So I think with this next piece, we're going to have some time for Q&A. But I would say maybe before we get into Q&A, for the panelists, did any of the conversation, did it produce any new reflections for you before we hop into the Q&A?
Oh, yes, it did. It made me think about innovation. So, it's been such a great conversation. I love all of this. I also love that line, giving hospice to old systems. I just have to say that. But Rachel, you said innovation was looking tension in the eye and then working with community to creatively solve a problem. I got no problem with that. I think it's, I do get frustrated though that people turn away from things that we know and it, for innovation for its own sake, let's say. I don't know, I don't want to get defensive about it, but I loved your definition, and I do get frustrated. I'll just say specifically with funders that, want the next shiny new object as opposed to, Kelly, what you said, looking back, what works for community building. I mean, there was so much richness in what both of you said about that, about the deep listening, about the invitation, about the reflection, about the forethought that we're not interested in quarterly profits. We are interested in the seventh generation. I think all of that is rich, and so I just appreciated being able to listen to all that. So thank you.
I just agreed a lot. And I knew that we were sort of talking about different formats of innovation or different spaces for that. If we wanted to go on a long like frustration of how funding works for a lot of this work, I find it very frustrating that a lot of funding is in these very short-term increments, like 1 year's maybe a 3-year grant. And it's really focused on outcomes in this very specific measured way. There's been some really good movement away from that with trust-based philanthropy, so excellent. But funding still tends to happen in these really short-term ways. And I think most of the work that all of us are doing relies on building trust and working through conflict and thinking long-term. If we're going to change systems, that's not going to happen in a few months or even in 3 years. That's looking at generational shifts, or at least something, a 10-year strategy for us to move forward. Kelly, I had so many quotes of yours written down, but one of the ones that I want to flag is just talking about how valuable it is to center the voices of community and how that helps us to nuance problems in a really specific way, where I think if we're just doing survey data and looking at qualitative facts about what's going on in a community, then we miss the real stories and the real complexity of what's going on. And then we create solutions that aren't actually solving the base of anything. So I just, appreciated that comment in particular.
Yeah, no, thank you. I have so many notes from what both of you shared. But I'll just say in terms of the um, nuancing the problem, we do a lot of applied research. So we do a lot of applied research. We run a community led research entity, and so where we're collecting the qualitative data. So the community members are trained to not only collect the data, but they analyze the data and then they report on that data. And so we bring that to what we call like our meso tables, and that's just where the various entities or sectors are organized to help define the problem. And that defining the problem is really what we're working towards, that becoming a community act, a community practice, that it's not just a few people defining the problem, but we have, various voices and perspectives at the table, at the tables to do that. And then in all the work with hospice and the 7 generations, I hope I mentioned this, but we're doing that in partnership with We in the World. And so much of that, We in the World, so much of that work that they're doing and we're doing in partnership with them is around the storytelling. And so I love the fact that both of you just really leaned in on how important narrative is. Dr. Shoma says there's a framework, stories to systems change, and we find that to be so effective, especially when you can hear stories about indigenous communities that really lacked resources, and so they had to think creatively. We see that in our rural areas, which lack resources, and how they have to think creatively, as well as our urban areas. So really, any marginalized folks, have the ability to really to take their experiences from the margins and using yet less to be creative around how do we do this together, because we don't have all the resources that we need. So I appreciate hearing both of you, lift up narrative.
I'll just jump in quickly. I mean, there were so many things that jumped out to me, but I think several of you mentioned that self-work I thought was so important to point out the self-work part of this process, that I think we rush in, we want to do something, that sort of pause, whether it be, becoming a better ancestor, but also like shaping, our thoughts and where our values really lie, and being able to identify that for ourselves, I think is a super important first step before we can explain that to someone else and do that communication, and really helps us, I think, lead to systems thinking, which is clearly so critical, because as you've talked about the nuances that you get from nuancing the problem with community, and that sort of anecdote that Laurie shared around just how complex nutrition can be, nutritional systems to impact education, to impact the economy, that we're in a complex system, that it makes sense that we need time to step back and have that thought about systems level thinking about how we intervene. But thank you all for so many great points. I'll stop there.
Yeah, absolutely. Now there's a couple questions that came in. Maybe we can get to a couple. Maybe we can stay on storytelling right now, this idea of narrative. So this question came in: how do we convince community leaders who are unpracticed in storytelling as an intervention that is worth investment? Maybe I can open up to anybody, see what y'all think about that question.
Who are we convincing, Kevin? Ask me again, or ask us again.
Oh, sorry. It says, how do we convince community leaders who are unpracticed in storytelling as an intervention that is worth investment?
I just think it's through doing it with them.
Mm.
Like, so, I mean, the model that we use is having one-on-one meetings with people. And so if I wanted to convince somebody that narrative and storytelling and connecting are important strategies, I would meet with them one-on-one and do it with them. And then depending on how that went, I might be a little pointed and be like, what did you think about this meeting? How did it feel for you to share your story with me and have that reflected back and heard? How did anything that I said about my story impact you? I think it's just through experiencing it. And a lot of times people are working in these spaces that's very data driven, and they think that they're supposed to be purely analytical all the time, and just haven't experienced something else.
No, yeah, thank you for that, Richard. It's almost like just like modeling it, right? Just like doing it. So this other question kind of came in, just this idea. We mentioned this idea of the status quo and tension. Someone asks, how do we disrupt the status quo when working within organizations or government that are not open to disruption? Anybody?
Yeah, I would say that systems are designed to protect themselves. So a good system, whether we're talking about in our ecosystem, which the Berkana Institute they have the two loop model that we adapted for the better ancestor work. But whether we're talking about the ecosystem or we're talking about our body as a system, a computer system, really good systems, their job is to maintain the status quo. So all systems, no matter what, are going to maintain the status quo, and so I think that we just have to understand that. And I think the goal is how do we disrupt that in a way without completely burning the bridge so we can work with those systems. But I think that disruption takes many forms. I think within large systems, it really needs to begin from within, for people coming and asking hard questions about the reasons why, the numbers reflect what they are. What are we not doing? So sometimes, I think, again, within systems, it may be that disruptive, questions that will get people to have to think beyond the answers that they typically get, or for them to face the fact that they just don't know. And so then we can go through a better exploratory process.
And Kevin, this is another spot where the spiral of silence comes in. Because if people aren't being vocal about what's wrong with the system and what needs to change, then people who think that there are problems might think they're the only ones who think that. So it's important for that vocalization and for people to be loud. And I think, Kelly raises a really important point. You don't have to be nasty. You have to be thoughtful. People are trying to achieve certain goals. There are ways that we can still talk to each other when we disagree. So we have to embrace that too. And at the same time, there will be people who have different levels of juice around this stuff. And I mean, y'all have been in different campaigns where there are some very demanding folks that actually help push the needle for the people who are maybe working an inside outside strategy. So, every context is going to be different, but all the things that all of us have talked about knowing what our values are, being able to express them, being able to say in plain language what it is we want and why that matters, all that's going to come to bear sort of no matter where you are in that on that continuum of vocalization, let's just say loudness.
I want to respond to this one too. So one thought I have is that there's really subtle ways that anybody can disrupt patterns in an organization. So one thing is that when I was a staff person, pretty low level at an organization that operated with a lot of power and control at a very strict hierarchy, we would have a team meeting and I would make sure that my body language wasn't exclusively oriented to the supervisor. I would shift my body language, like my eye contact, my posturing towards my peers to indicate that I respect their opinion and I want to hear from them just as much as I want to hear from my supervisor. So even as somebody who didn't have a lot of power within this system, there's ways that I can subtly shift and redirect those things. And especially if I was the supervisor within an institution or had some level of management or more power within that organization, there's other subtle things that I can do without changing any policies, without doing anything new, without even like saying anything about it. I can just go ask people for their advice. I can say, what do you think about this? If the thing that I'm trying to disrupt is the hierarchy. The second thing is sometimes we just build the alternative. So in one of our rural communities, we have a lot of systems where you have to ask permission from people. You have to be like, will you please do this for us? And so this one community was asking their county and city government repeatedly for different things like bike routes. And the city and the county were like, oh, we don't have money for this. It's not a priority. And they kept asking and asking. And eventually they said, never mind, like we will just do it ourselves. And so this group of people fundraised, asked for tons of donations and volunteers and made their own bike routes. And then at one of the next local elections, new people were elected into their county and city offices because the community said, wait, we could have had this all along? Like, why haven't our city and county been doing these things for us? Why is this random group of community members putting so much effort into things that we all want? And so by just doing what they wanted to happen, instead of asking for permission over and over again, they not only got the thing that they wanted immediately, which was the bike routes, but they also ended up sort of accidentally shifting the local politics in their community.
Yeah, no, thank you for that, Rachel. I think somebody said something earlier about letting what you care about guide you, right? And so I think like having that energy to kind of guide you to create those policies and show people what's possible sometimes without asking for permission, just doing it, right? And then just going from there. We maybe have one more time for one more question, maybe just to reiterate, because I know we talked about, share values, and we definitely had some strategies that folks said earlier. Are there any values that have been shown to be more effective than others to prime in conversations or messages that y'all have found that's in your work? Any particular values? Maybe as like a starting off point that folks can have in conversations with their people.
I think that's a tricky question, Kevin. Because um, it's true that we want to lift up shared values, but I think that we want to identify the values we hold, and I think the bracketing exercise is a really fun way to think about how values compete within ourselves at different moments. And so in some ways, it's the question's contextual because you want it shared. So the question is, well, shared with whom? And what are you trying to do? And I don't want to advise people to identify someone else's values and go to those. I want people to know what they care about and then express that in a way so that others who care about the same thing will be attracted to it. And that also involves saying what we mean in plain language because people do interpret values differently. There's a lot of research that shows that, we all think fairness is important, but we have different meanings of what fairness is about. Is fairness about justice or is fairness about getting back what you put in? Is it about proportionality? So people can interpret things differently. I think the important thing is for us to know what it is we want and why we want it.
Yeah, yeah, I agree with that. I think every community has its own culture that has been, developed over time. And I think that it's important for a community to come together and conduct an analysis as to what the current structures are that may be maintaining those status quo, what the analysis, their political analysis as well. That's very important. But then also just the relationships. Why is it that some communities are able to to engage while others are not? Like we have to have those conversations. So I think that, first, being able to have that shared space to conduct such analysis and to be able to talk about it is important. And then from there, I think one will have a better idea of, okay, as we move forward, what are we going to value that's going to be different from what we valued in the past through our actions, I would say.
No, thank y'all both. I think we are right up on time, right, Ruth? We got about 5 minutes left, and we got some time for.
I think we have 5 minutes left. Yeah.
Yeah. So I might pass it over to you to kind of just, close us out with the wrap up. And I know that there's a survey that Mario just dropped in the chat. If folks can take some time to look at that. But just, Ruth, I know you may have some things you may want to just wrap us up with.
Yeah, I just want to thank all of our panelists and speakers today. I mean, this is just such a rich conversation. You've all brought so much for us to think about, and I think that's reflected in the number of people that have hung on with us, even through these 90 minutes to sort of get to that. In so many ways, it's given us a lot of questions to ask as much as answers to ask of ourselves, I think, as we go away and think about what our next steps with this work are. I'd like to thank Kevin as well as for such great moderation of the discussion today. We're dropping in the chat a link to a survey that we like to sort of follow up with folks, find out what came up for you in this conversation. We'll be sharing the recording. If you sign up to the BHPN newsletter, I think you'll be getting, I think anybody who's registered will be getting a copy of the recording going forward. And we will be producing a 2-pager synthesis of the discussion for anybody that wants to take away some of the headlines, the main points, and next steps for them and their colleagues. So I think that's it from